Hello and welcome to Right Parenting Tips. Today's topic is Top 11 Myths About Antibiotics. Myth 1. Antibiotics are useless. Wrong. Since the time Alexander Fleming discovered the first antibiotic, penicillin in 1928, antibiotics have saved millions of lives from deadly infections. Myth 2. Antibiotics can cure any infection. Wrong. Antibiotics only work against bacterial infections. They are useless in viral, fungal, or parasitic infections. Almost 90% or more infections in children as well as adults are viral. So, antibiotics are not needed in most infections. Myth 3. All antibiotics are one and the same. No. There are different groups of antibiotics effective against specific bacteria, and are used accordingly. Penicillins, cephalosporins, macrolides, aminoglycosides, tetracyclines and fluoroquinolones are important antibiotic groups. Myth 4. The latest antibiotics are superior. Not always true. Even though the new antibiotics try to improve the efficacy and reduce the side effects, they are usually costlier and less studied than their predecessors. Myth 5. Start antibiotics for any severe symptom. Wrong. Many times, the severe symptoms are caused by non-bacterial infections or other medical conditions, which don't need antibiotics. Myth 6. If antibiotic is not started early, then the illness may worsen. Mostly not true. In fact, this irrational fear based on wrong assumptions, is the most common cause of needless, excessive antibiotic usage. Myth 7. Antibiotics can be started on our own. Wrong. Antibiotics should be started only after proper medical advice, which includes history, clinical examination and sometimes lab tests to understand the type of illness. Myth 8. Just use the past antibiotic prescription if similar symptoms recur. No. Repeating the same antibiotic course for similar symptoms again and again is a dangerous practice. This leads to antibiotic resistance, where the bacteria get used to, and stop responding to that antibiotic. Moreover, the symptoms may be caused by an altogether different medical problem. Myth 9. Antibiotics can be stopped once the patient starts feeling better. No. Incomplete antibiotic course means incomplete cure, and it may lead to either recurrence of infection, or antibiotic resistance. Myth 10. We can modify the antibiotic dose or course on our own. Wrong. The antibiotic dose, duration between doses and total period of treatment are decided after careful medical evaluation. The doses in children are decided as per their weight. These recommendations are as per the pharmaceutical research, and they should not be tinkered without medical guidance. Myth 11. Antibiotics are full of side effects. False. Agreed, that sometimes side effects like nausea, vomiting, abdominal pain, diarrhea, skin rash or other types of serious reactions can occur. But these are rare, and the benefits outweigh the risks. So the message is loud and clear: antibiotics are important, life-saving medicines, but avoid their misuse.